Have you ever made an important decision knowing that you may not have all of the facts and later come to regret it? Well, with your health, especially if you suffer from a chronic disease, you may not have the luxury of regret. CardioLync helps avoid regrets by providing the patient's entire picture to doctors and to patients. CardioLync provides single access at the point of care to all diagnostic and medical event history of each patient, interfacing, communicating, sharing, and exchanging images and data across specialties, across technologies, and across hospitals. Diagnostic tests can be administered locally by an imaging technician and be interpreted by a specialist who may be located elsewhere. As a matter of fact, this is how CardioLync is in service today in Jerusalem for outpatient cardiographic services. Patients who suffer from chronic diseases such as ALS, asthma, cancer, COPD, cystic fibrosis, diabetes, heart disease, kidney disease, liver disease, often have multiple concurrent conditions and complications that require regular visits with a number of different specialties. This puts them at increased risk for severe adverse effects if information is not shared between care settings timely and accurately. But unfortunately, health systems are fragmented with many different providers involved in the patient's care, so that even in the most advanced healthcare systems, information often does not flow. CardioLync developed technology that bridges these information islands to improve outcomes for patients by facilitating access to diagnostic information when and where it's needed. Using CardioLync, patient data does not get overlooked so that correct diagnosis of chronic conditions is made and the correct life-saving treatment plans are reached. With the COVID-19 pandemic and its pressure on medical resources, CardioLync allows patient monitoring and remote risk assessment while connecting the dots for patients who may be suffering from undiagnosed underlying conditions. Research published after the first wave of coronavirus in Italy shows that 3 times the normal amount of patients with heart disease died from sudden heart attack because they were either afraid to go to the emergency room or because the hospital could not take them. They report thousands of patients with acute and chronic conditions have not accessed care for many weeks. As a result, they predict a further rise in avoidable deaths. To prevent this, using CardioLync, doctors can identify those who need urgent access to care and prioritize outpatient visits based on severity. Patients with mild conditions could be managed outside the hospital by general practitioners who can consult with in-hospital specialists. This way, caregivers can proactively flatten the curve of patient admissions and emergency room presentations and take preemptive steps. If CardioLync were available just a few years ago, perhaps my mother would still be alive today. She was misdiagnosed with kidney disease, and by the time her condition was finally discovered to be cancer, it was too late. CardioLync, we aim to save lives. Thank you.